Welcome back, everyone. I hope everyone had a great lunch, enjoyed a brisk walk, and is ready for our afternoon panels. Our third panel is Strengthening the Supports, Fair Pay and Protections for Caregivers. This conversation focuses on the caregiving workforce, the millions of workers who care for children, seniors, and people with disabilities across the country. Moderating is Congressman Jimmy Gomez. Joining him are Mary Turner with the National Nurses United, Matt Yarnell with SEIU, Hae-Young Yoon with the National Domestic Workers Alliance, and Astrid Zuniga with the United Domestic Workers. We'll have Q&A at the end of the panel, so please have your questions ready. Without further ado, we'll get started.
Good afternoon. How's everyone doing?
Good.
I had to, it's been a busy morning so far. First, let me just thank the panelists for being here. This is one part of the summit that I'm very familiar with. And without a panel on the care workforce, then we wouldn't really have a summit after all. Because in the end, AI cannot replace the care that these individuals have to deliver. Growing up, my mom was an in-home support service worker. She worked multiple jobs to make ends meet. One, she often worked first in-home support service worker through a private referral agency, and she would take care of a couple of I would say customers or clients, but they really became like family, especially somebody, her name is Lonnie, who passed away years ago. But my mom grew very close to her, very attached to her, and it's something that I remember going to visit, helping out my mom, but also just the stress of the fact that how sometimes only you get paid very little, and you wouldn't get the hours that you needed. So she worked multiple jobs. I say she worked 4 to 5 jobs a week is because she would work that in the morning, another job in the evening, often at a convalescent home in the laundry department, and then 2 jobs on the weekends that were different from those 2 jobs. And this is all just to make ends meet. So these individuals are often the lowest paid with the heaviest workloads. And that's why we want to make sure that we have a whole panel on workforce. We have some great leaders with us today. Carlos introduced them, so we're going to just jump right into it. One is Astrid Zuniga with the United Domestic Workers, which my mom was actually a member of out in Riverside County in California, and I didn't know she was a member until years later when I was giving her a ride to work or giving her a ride to a doctor's appointment, and she said she knew I was working for a labor union, asked me, and she goes, "Oh, you know, I was a member of a union once." I'm like, "Had no idea. Why don't you tell me about it?" And then she told me it was what part of the union it was, and then she couldn't remember the name, and she goes, "But the symbol was a white dove." That goes years back. So with that, Astrid, I'd love to just kind of get your perspective. What are the primary drivers of the caregiving workforce shortage? What do we see out there, and how would federal investments in job quality help attract and retain the workforce?
Thank you very much, Representative Gomez, and I appreciate the opportunity to be here and share some of our experiences with you all today. So, little backstory, we represent a little over 250,000, close to 250,000 home care and family child care providers across the state of California. For us, some of the roadblocks over the years has been funding, right? When you lose Medicaid funding, you lose funding to the vital programs that allows our loved ones to remain in their home. And in turn, our child care providers also are subsidized family child care providers that work out of their homes. And all of this is attached to funding. And if we don't have adequate funding and revenue streams coming in, then these programs will cease to exist. And as part of the logo of today is we are in a caregiving crisis. And none of us are getting any younger as much as we would like that. And we try to roll that clock back. But we have our senior population, we have our children, and we have our communities disabled that need vital care. Unfortunately, in California, we also have a system where the federal funding comes into the state, and then the state reimburses the counties. And the counties don't want to invest in this program. A lot of them tend to look at it as a burden for them to have to do. And when you have to negotiate with 58 different counties, there's not an equal playing field across the field for workers. So you may go into one part of the state where that Board of Supervisors really cares about the program, and they will get paid a better wage. Where you go into an area like mine, and we had a county that was in negotiations for 8 years over minimum wage. We even passed a piece of legislation that implemented a penalty on counties who didn't negotiate in fair and good faith. And they took the penalty instead of giving home care workers a living wage. Not even a living wage. I mean, the bare minimum, nickels, and a wage increase. So that is one part of the problem. And so we're working really hard to get to an issue which is statewide bargaining, so that our workers can have the opportunity to, get to a living wage, because it should be equal work for equal pay no matter where you live. And our child care providers, they are constantly, they are now at statewide bargaining. We are very fortunate. It took decades for us to get our child care providers there, but they are able to negotiate with the state and have a little bit of a retirement and some training funds. But the state is dragging their heels when it comes to the actual true care of cost of care, because they are almost having to pay out of pocket to end up having to sustain their business, so to speak. And it becomes burdensome, but our child care workers do it because they love their children. And no matter what it costs them out of their own pocket, at the end of the day, the reimbursement rates will come as they come, and we'll just continue to fight for it. But it really comes down to funding is a huge piece in making sure that this is a respected workforce.
And it's oftentimes you see that people can make more by going to work at a fast food restaurant, which
Yes.
if you think where I believe we should put our efforts and salary and resources is really when we take care of other people. And I remember this as a kid, my mom getting a 10-cent raise for the year. 10 cents. I know I'm like dating myself. Maybe it was a long time ago, but it's not, when they get raises is not what people think. And that's one of the things that we need to kind of work on. The wage is something that is a barrier, and then a lot of folks need to do the work because they need to take care of their family, especially the in-home support service workers. We also have Mary Turner with National Nurses United, President Turner. We have a lot of presidents up here. As an intensive care unit nurse at a hospital, you care for people of all ages and often when they are the sickest. What do you believe are the major issues impacting the care workforce in acute settings like hospitals?
All right. Thank you, Representative Gomez. As you say, I'm Mary Turner. I am president of National Nurses United. I'm from the great state of Minnesota. But I always say, more importantly, I am still a working night shift intensive care nurse in the metro area. And in the last decade and a half, I've been heard to say this, that nurses, especially in acute care hospitals, see the effects of bad policy all the time. or more importantly, the lack of good policies. Because that's what we're talking about here today, is trying to institute good policies that take care of the people and take care of my patients, okay? And when I say the effects of bad policy, what are some bad policies that we've had lately? Oh, I don't know, $1 trillion cut from Medicaid and the ACA premium subsidies discontinued. Okay, so what does that mean in my world? That means people, my famous line lately is, we're finding more people are brought into the hospital, more importantly, to the most expensive care there can be is in intensive care because they are found down. Why are they found down? They haven't had any preventive care. And this is all ages. Just think about it. You talk about the care worker that can't afford rent, can't afford food, can't afford child care. Well, I'll tell you something else. All ages, they can't afford medicine. Okay? That's huge. And people have, and they will continue to start cutting corners when it comes to food, say, or medication. And when they start cutting things like medication, they end up in the hospital, okay? And so that's why all of these care issues on the outside are just as important for us on the inside. And on the inside, what are we going through right now? Short staffing, workplace violence. Do you know that we did a study in National Nurses United in 2024, and 8 out of 10 nurses have experienced some kind of workplace violence at work? Okay, we're supposed to be these angels of mercy that nobody touches. Are you kidding me? We're more at risk in our healthcare environment than policemen, other people, we're more likely, 12 times greater likely to be hurt at work. Okay? And I know in California, I love it, they've got ratios that, guess what, when it went into effect over a decade ago, I don't think the healthcare system collapsed, did it, in California? No. What it did assure is that they would be safe staffing, which has been proven to increase outcomes, be cost effective, and this kind of thing needs to go through federally, just like everything else we're talking about today. It needs to go through federally. And workplace violence protection needs to go through federally, because there are going to be states, Minnesota and California are very, very high density union, okay? But many states will never see the union density like what we have in California and Minnesota. So we make higher wages, okay? But there's nurses, I remember a few years ago finding out, say in the West, it was either Colorado or something like that, where those nurses topped out at $25 an hour. At that same time, a starting wage in Minnesota was $35 an hour. Okay, so to go by Minnesota nurses make great wages at all, and California make great wages, that is not all across this country at all. And nurses are leaving the bedside. Okay, we got 1 million nurses that are out there that could be working at the bedside, but they are not because of the working conditions, and that is a tragedy.
Thank you, Mary. And you probably didn't know I was also a political director of our nurses union, so I know I understand a lot of those issues, and oftentimes now hospitals and groups of hospitals and CEOs are often choosing to put off negotiating with unions. They'd rather spend $1 billion on union busting than actually pay the increased wages that would cost them less in the long run. So we have a lot of issues. Now we have Matt Yarnell. He is the president of CEO, but SEIU Healthcare Pennsylvania. I thought it said PA, and I was like, physician assistant? So, Pennsylvania. Another issue that comes up in conversations about the caregiving workforce is a need for stronger training, clearer career pathways. And caregivers are responsible for a variety of tasks, from assisting with activities of daily living to monitoring health conditions and coordinating with medical professionals. If you heard Andy Kim talk about it, and also Stephen Horsford, whose mom had to move in. The coordinating of the care is such a challenge, even for a U.S. Senator and a member of Congress. So imagine if you're trying to figure out how to start a career in that. Where do you start? Where do you see the opportunities to get career advancement? So I want to kind of get a sense from you, what role should the federal policy play in expanding training and credentialing and career pathways for caregivers that will make this career a more long-term sustainable option? I recognize my mother. She had that one client at the end, and she chose not to, once she passed away, chose not to add more clients for a variety of reasons. Wages, main part of it, but also how difficult it is. So the question becomes, how do we use federal policy, training, resources to create long-term professions across the field?
Great. Well, appreciate the invite to speak today and your leadership on this, Congressman. And I would be remiss to not say that I'm also a dad, and so I was excited. I was like, there's a dad's caucus. So I have two young sons. Both were adopted at birth. And I just want to say one other thing. One is was born addicted and has a lot of medical challenges and uses Medicaid. And so, as we're seeing the attack on Medicaid, it is all families in this country who need supports and services for their kids. So it's near and dear to my heart. I think, as folks said, I'm the president of the Healthcare Workers Union in Pennsylvania, and a former caregiver myself. I went to work at 18 in a nursing home with the hopes to be a registered nurse. And in 3 days on the job, I knew that I wouldn't necessarily want any of my family members to live in that home, and it wasn't because of the people either running the place or my fellow co-workers, but just the system itself was built more like a factory than a system that is actually valuing human life and people's ability to live with dignity. So that's a long time ago in the late 90s. But I wanted to just spend a little bit of time on the workforce itself and get to the Congressman's question here. I think there are 4 kind of policy initiatives that we think are really important as we're kind of walking forward. One is we need to transform the investments in long-term care broadly and child care. And I'll come back to that in a minute to say a little more. We also think we have to transform the investments in the care workforce specifically, federally. And we also need to reform labor laws. I think we heard Mary speak to this, but it is nearly impossible for workers to organize. You have to walk through fire. And when you think about the caregiving workforce, home care workers in particular, domestic workers have largely been written out of labor laws. They don't even have a right to collective bargaining, so you have to go through a whole process to be able to set that up. And then lastly, we think, given the assault, dehumanizing, and just nasty, approach to immigrants in this country. Immigrants are a really important part of our caregiving system, whether it be in long-term living or acute care hospitals, home and community-based services, and also in child care. So there's sort of 4 areas we think we have to dig in on. Just on the first piece, on investment, we actually think that this country's approach to caregiving it's really a private burden, and we really think it should be infrastructure. That to be able to have a thriving economy, people have to be able to get care, and whether that's child care, or whether that's senior care, or whether that's supporting somebody who has disabilities to be able to live independently and be able to thrive in society. So that is one federal fix, we think. The other immediate thing that could happen is to expand Medicare to be able to pay for long-term living. So when the senator spoke earlier, I think about Janet Williams, who's been a nursing home worker for 45 years in Uniontown, Pennsylvania, and now has an aging mother who has dementia. And because her mom has something, a value, a home or a car, she actually can't get Medicaid to get the kind of services she needs. She doesn't need to be in an institution, but now I've got Janet, who's worked 45 years as a caregiver, caring for others, trying to figure out how to continue to work full-time and care for her mom. And so when the senator spoke about his experience, I just think that is one way we could solve that issue is to actually make Medicare pay for aging care, in this country, so you don't have to have literally no resources to be able to access care. And then just the other thing I would say is, at the same time, we know there's a caregiving crisis in this country. The assault on Medicaid and SNAP and other social services is really deadly, frankly. I mean, it's going to mean people, if you take $1.2 trillion out of the system, that means less care for people. That means less wages for people in a workforce that's already under siege. Next piece I would just say is like transforming the investments in this workforce. To your question on training, education, career pathways, we think that like one thing that has to happen is folks have to be able to organize and be able to collectively bargain and be able to make these good jobs. Like any service sector work in this country, if it's ever going to be valued and respected, workers have to be able to come together and organize and be able to have autonomy and be able to grow unions and do it in a way in which I think what you were speaking to, is sector-wide. Our labor laws are deeply broken in this country. You have to organize one little unit by one little unit, when we know that if we're going to take on a large industry, you have to be able to have like a sector-wide approach. So that is another area that we think is really important to focus on. And then in terms of just this caregiving workforce, I think just a couple things I wanted to put in the room. I didn't hear it necessarily come up clearly earlier. For the median wage for a home care worker in this country is $22,000 a year. If you do the math on that, that's less than $10 an hour. That's the median, so that's like in the middle. So I don't know about all of you, but I'm pretty sure you couldn't even pay rent in DC on that, for sure. And also, in addition to the wages being $22,000 a year for home care workers across the country, 59% of workers rely on other public services and Medicaid funding to be able to live. So like that is and again, we have $1.2 trillion cut coming down the pike on this workforce in particular. And then on the child care side, the median wages for child care workers is $33,000 a year. So again, if you're looking at full time, doing the math, it's like $15 and change. And that workforce, at least 40% of those folks rely on Medicaid funding and other avenues to be able to patch together a living for their families. So again, I just think that speaks to the fact that we've got to figure out strategies to be able to empower this workforce to organize and collectively bargain to build a better future. Last thing I'll say is on recognizing the immigrant population in caregiving. This is super important. In particular, for home care workers, about 33% of home care workers are immigrants, and in child care, it's about 20%. And that's not really inclusive of the kind of family caregiving that kind of goes unseen. So it's actually higher when you get to that group. But when you see the kind of assault that we've seen on immigrants in Minnesota and in Los Angeles and in Portland, the impact on our economy. I don't think anyone even understands yet in the inhumanity that's happening, coming out of this White House and this Congress. So. Anyway, there's a lot of work to do. To sum up your question, we have a lot of work to do to be able to get these jobs to a place to be jobs that people want to be able to stay in and build a career. Last thing I'll say is there's a number of purple shirts in the back of the room. There are home care workers here from Pennsylvania. Yeah, we should give them a round of applause. From Minnesota, from California, and from Washington. So they made the trip in because they're going to go to a hearing that's happening later where we're going to continue to hear the Republican side of Congress claim fraud, waste, and abuse in this sector, which is an outrage. Our experience as a union and certainly as workers is the people who commit fraud, waste, and abuse are large providers, not individuals who are using the system to be able to live. So with that, thanks.
Thank you, Matt, and thank you for mentioning how immigrants are also a large part of this workforce. Hae Young is the vice president of the National Domestic Worker Alliance. You give her a round of applause. It sounds like just first tell us what your organization does, but also how talk to us about how increased immigration enforcement activities are affecting the care workforce, particularly immigrant care workers, and what policies at the federal level could help protect workers while ensuring they can continue their care for families and across our country. And I know that part of it is also stopping just the rampant abuse of our communities through ICE and CBP. So kicking over to you.
Thank you, Representative Gomez. First, I want to echo the appreciation of your leadership on care and really convening this very, very important and critical conversation in this very beautiful place. So thank you. So I think Matt has talked about this, everyone has talked about this, that immigrants play a foundational role in caregiving in our country. As Matt, you talked about, nearly 30% of direct care workers are immigrants. 1 out of 5 child care workers are immigrants. And what that means is what is happening to immigrant communities due to aggressive and chaotic set of policies by this administration is affecting all of us who's touched by care. So that's the workers who provide the care, people who rely on their caregiving, and the economy that runs on it, right? And so I think what we're seeing and what we're hearing from our members is that people are too afraid to go to work. Child care workers are afraid to go to work. Parents are afraid to send their kids to caregiving child care centers, which means it's forcing child care programs to shut down, right? Because of policies like this administration eliminating a policy called sensitive location, where in the past it has prohibited ICE immigration enforcement in such locations like child care centers and schools and houses of worship. I've heard stories of parents in Minnesota where ICE agents stood outside of schools, and kids are afraid to go to school and parents are afraid to go to work to send their kids, right? And I was really struck by a story that ran in a local newspaper in Florida. It talked about a senior resident home in Boca Raton, and 1 out of 10 staff at this residential care place was Haitian immigrants who had who were part of this program called temporary protected status, which means that they had legal status and that work permit to work and live in this country legally. And we know that this administration abruptly ended that program, along with Haiti, many other countries that had temporary protected status. And so these residents, and many are survivors of Holocaust, were too afraid for their caregivers, and they asked, this article talked about how these residents started to talk about how they could hide the caregiving workers in their apartments because they wanted to avoid their workers being deported to a life-threatening place in Haiti. To me, that story really grounds us what is at stake for all of us. That, as Matt talked about, the future of care and the future of immigrants and the future of immigration policy are fundamentally connected and interdependent, right? And so we talked about on this panel what's broken. Our labor law is broken. We need to rebuild a robust care system. And part of that holistic plan is that we really need to build a robust immigration policy that allows a legal pathway for those who are here, who are doing this work, because every other way, they're Americans, right? So I think there are some more immediate things that I want to just draw everybody's attention. And thank you, Representative Gomez, for signing on to the discharge petition that would extend TPS for Haiti. We need to get ICE and CBP out of our communities. And thank you again for you and the rest of the Democratic caucus for standing strong, saying we need to rein in and hold in accountability. These are immediate things that we have to do. I think in the long term, as we rebuild a care system, I think fixing the immigration system has to be part of a robust, multi-pronged solution to build a robust worker pipeline, give people a sense of security and what they're entitled to. And I would also say that this administration last July rolled back home care workers' right to minimum wage and overtime protections. The federal minimum wage right now in this country is $7.25. And this administration said, this nearly 3 million home care workers who go to work every day, who power our economy every day, because home care is one of the fastest growing occupation in our economy, said this workforce is not even worth of $7.25 for their labor, right? And that kind of treatment of this workforce that, as Representative Gomez, you talked about, we're talking about people like your mom, right? Saying that they're not worth it. So I think that's also an important fix that we need to do.
No, thank you. And I think you're all touching upon a lot of critical issues when it comes to wages, protections, job training. It's all connected across the board. And then at the same time, recognizing that a lot of the individuals that are providing care are immigrants. One of the things, my mom's a U.S. citizen now, but I worry just as more now than ever of her getting detained, either coming back to the country or just being on the streets. Not because she's really fair-skinned, but her English is not very good, so she ends up could get targeted, not based on the fact that she's a U.S. citizen or not, but based on how she speaks, what she looks like, and the job she does, and that we just see that across the board. And we have some tough times ahead, but I know this is gonna be such an important workforce. And then we don't even talk about how it impacts people's health. I met during the raids in LA, I went to a community clinic, and a doctor said a patient who was recommended that they needed to get dialysis to get it started ASAP was putting it off because of the raids. Well, what happens as a nurse, what they end up going to the ER, they have more acute illnesses, and that's only to cost us a lot more. So it is something that we know too real, and that when that happens, our patients are worse off, our caregivers are worse off, and our entire community is worse off. I know we're going to question and answer now. Wanted to kind of kick it over to question and answer. Don't hold back. We have 3 presidents and a vice president up here. Don't hold back.
They're all just ate lunch and they're tired.
Yeah, no, I'll ask a question. This is the one part. Let me see. One of the things I wanted to talk about is just how does strengthening the professional caregiving workforce help support family caregivers, and what policies could better recognize and assist those family members providing unpaid care? And the reason why is no matter what, there's going to be gaps, right? If you're a parent and you take your kid to school, well, then there's the hours between 2:30 and 5 when you get home from work that you still need to cover. My wife and I have childcare for my son Haj, and we were discussing, okay, we give him childcare right now that we pay, and it's a lot, but it's from 8 to 5:30. Well, if we put him in school, we still have to pay for after-school care that costs just as much. So we're kind of stuck between a rock and a hard place. Or you have people with elderly parents that it might have an in-home support worker or a nurse, but oftentimes it's one nurse for 40 hours a week, which my wife and I used to do. We also have a member, Nanette Barragan, I think I can share this. She is now an in-home support service worker as well as being a member of Congress, because she takes care of her mom because they don't have enough resources to fill all the hours of the day that her mom needs. So how does strengthening the professional caregiving workforce help with unpaid leave?
I'll chime in on that. Let me just say, truth be told, there should be no unpaid work or unpaid care. So, yeah, I have president as a title, but my main title is mom, and I'm a caregiver for my adult son who has a disability. He has autism, intellectual disabilities, and epilepsy. And yeah, I get paid for taking care of him. It is a full-time job. He is at the severe end of the spectrum. He needs someone there 24 hours a day. He's a flight risk. He needs somebody who can bathe him, change his diapers, who can make sure he eats the appropriate meals, who can also help make sure he gets out into the community and he's a part of that. And on the other hand, I saved the state millions of dollars in which it would take to institutionalize somebody like this, and that is no life for our loved ones. No one wants our loved one to be in an institution where they're not going to receive the dignity and respect that they deserve in order to thrive. And at the end of the day, they'll say that this isn't, quote unquote, a real job just because I don't work a 9 to 5. No, mine is 24/7. And our workforces deserve to be paid living wages and the respect for the work that they do. They are truly saving lives. There are many families out there that just, they're not given that respect. This is not looked at as a traditional workforce. And we need policies that will ensure that we are investing in this workforce, that we are making it a desirable workforce. Benefits, retirement would be awesome. Just a little bit over minimum wage would be awesome. And we really need some solid policies to come from the federal government in order to make that happen.
Can I just add here? So by 2034, our country is going to need to fill over 9 million direct care jobs. These direct care workers who provide long-term supports and services to older adults and people with disabilities. Because baby boomers are aging and people are living longer due to technology and advance in medicine. So that's the number of need that's out there, right? And so we will need to catch up very, very quickly. So in the course of that, there may be some folks who are going to need to provide, family caregivers are going to be critical. But I would say that this need is out there and we are rapidly approaching. And so I echo what my co-panelists in terms of the need for investment into the system so that people who need that caregiving get the need in the way they deserve it.
Mary, then Matt. Go ahead, Mary.
I liken this to, I was a COVID ICU nurse from the very beginning of the pandemic. And all the trials and tribulations we went through there, I was just as grateful for the people that were on the outside taking care of people, the grocery workers, the healthcare, the care workers that were keeping people out of the hospitals because there were no hospital beds, okay, folks? Every bed was a COVID bed, okay? And so I was just as grateful. And I would say that, in regards to ICE, and the effects that they've had and with our immigrant population, you talked about dialysis in our Somali community in Minnesota that I'm very involved with. We were hearing stories about people not wanting to go into dialysis. Do you know how long you last if you're getting dialysis and you don't get it? Maybe a week at best. This should resonate. Young moms about to deliver that were too afraid to go to the hospital and having to deliver their baby at home. Just think about that. And so this business that people are too afraid. I mean, I'm sorry, but the National Nurses United has called for defunding this whole ICE business. Okay, border control is one thing, but this nonsense that we put up with in Minnesota, that has got to go. Okay, that's just got to go. But I wanted to reiterate just how important it is, our care workers, because remember how I said you don't get the care and so you end up in my ICU? A while back, just the bed alone on the ICU that I work with a few years ago, it was $6,000 a day for the bed alone. Just for the bed. Okay? So this doesn't make any sense. You know what I mean? Not to pay our workers $7.25. Seriously? I think we pay babysitters now more, don't we? pay 12-year-olds more to babysit? That's ridiculous. I know in Minnesota, our healthcare workers, they unionized, I think, with the SEIU, and I think $20 an hour. And we're one of those states that got paid family leave, and guess what? Everyone loves it. And we're not broke yet, right? Yeah? But I will tell you in Minnesota, and this is what you got to guard against, is that we're kind of a half and half state. The Republican side is just, gunning to get rid of it. But the people love it.
Matt?
Yeah, two things. I mean, as a former caregiver myself, it breaks my heart kind of where we are in this moment, in this time in our country. And I think about the two things. One is we can figure out how to pay for bombs and war, but we can't figure out how to pay for care in this country. And as we speak today, this Congress, the Republican-led Congress, is going to weaponize Medicaid. They've already done it in Minnesota. They're deferring payments for almost $300 million on Medicaid dollars. That means people will not get care. That means people will not get the services they deserve. And so I just think at the same time, Congressman, when you're saying what do we need to do to move forward, I think one thing we have to do is understand that the way in which this administration and this Republican Congress are weaponizing their arguments around fraud, waste, and abuse on Medicaid dollars and the impacts that's going to have all across this country. And so it's imperative that we both protect Medicaid but also expand what Medicare can pay for. We live on the richest planet, the richest country on the planet. We should be able to figure out how to take care of humans, and we need universal access to child care. We need universal access to health care, and the workforce is key in that. And it's not by accident. When you think about home care workers, long-term care workers, child care workers, but home care in particular, that industry is majority black women, largely, immigrant women that do the work. And again, we're written out of the rules from the inception. So we've got some real work to do there. There are glimmers of hope. The organizing that you referred to, in Minnesota, in Michigan, home care workers won back their right to have their union and are making advances there. Just a couple of days ago, in Virginia, home care workers have just secured their right to have collective bargaining. So there are paths forward, and I think glimmers of hope. And I think the caregivers that were in the room stepped out to this hearing. But I just think home care workers in particular are some of the most resilient, incredible humans I know. And right now, Dr. Oz is calling them, fraudsters, basically. And they're going to do that all around this country in every blue state. They're going to try to figure out how to defer Medicaid payments and harm people. And we're going to have to organize and stand up and fight back. Thanks.
No, thank you. And I think what you're highlighting, not only about just the backbone of this industry, these individuals, but also the priorities. Right. The country under Donald Trump has engaged in a war, I believe, of choice against Iran. I'm not saying that Iran is not a bad country or don't engage in terrible things, but it is a war of choice. To the fact that his director of the National Counterterrorism Center just resigned because he said that Iran was not an imminent threat, and that Trump and the administration engaged in this war of choice that's costing billions of dollars. And that's when people start thinking, if we can afford that, why can't we afford to pay care workers, people that are taking care of families, making them stronger, more? Why can't we invest in training? Why can't we invest in reducing wait times at hospitals, making sure that people don't go broke? And it's something that people are talking about across the political spectrum. It's not just the people on the left. It's also the folks on the right who said they voted for Donald Trump because he would end foreign wars and put America first. Now, instead of waging a war of choice against Iran, we should be waging a war against income inequality, against the affordability crisis, against the fact that people do often go broke because they got sick or one of their family members got sick. Any final thoughts before we end the panel? Mary.
Could I add to that access to care? Because there's the other thing with the Medicaid cuts is that we are at risk. We're doing a red alert bus tour all across the nation from National Nurses United, highlighting in multiple states the hospitals that are at risk to close. A lot of them are rural, but they're also inner city also. And this decline in access to care is just as much of a burden. You're already living in rural wherever, where your hospital is 30 miles away. Okay, now that closes and now it's 100 miles away. Okay, this is what also that Medicaid cuts is doing. And you cut off our access to where we can go to receive medical care, and it affects all generations and every political, like I say, as an ICU nurse, when someone is in that bed and I hook them up to a monitor, I don't care if they're Democrat, Republican, Catholic, Lutheran, whatever. And because all I see is a green line for their pulse, blue line for their heart rate, their respirations, and a pink line for their blood pressure. Okay? That's the nurses' world. And that's why we're politically active, because everything out there affects my patients and the people I serve.
Well, let's give them a round of applause. Thank you so much. Mary Turner, Astrid Zuniga, Matt Yarnell, and of course, Hae Young Yoon with the National Domestic Workers Alliance. Let's give them a round of applause. Thank you.
Yeah.
Are we doing it? Are we moving for 4? No. I'm just saying.
Thank you, Carlos. I'll be in touch.
Yes, please do. I'm just saying, bring our new people up.
Send them up.
Yeah. Please. Hi, Congresswoman. We'll have you right up here. And we have stairs around. Okay, there you go.
Stairs in the back.
Our fourth panel is Bridging Work and Family, a national paid leave promise. This discussion will explore how paid family and medical leave policies can help workers care for their families without risking their jobs or financial security. Moderating is Congresswoman Brittany Pedersen, representing Colorado's 7th District and a member of the Congressional Dads Caucus. Joining her are Gary Barker with Equimundo, Marianne Belsort with Family Values at Work, Jocelyn Fry with the National Partnership for Women and Families, and Vicki Shabo with New America. As usual, we'll take questions at the end of the panel. Thank you.
Can you all, there we go. Hi, everybody. My name is Brittany Pedersen, and I represent Colorado's 7th Congressional District. It's wonderful to be here with you today. Thank you for the work that you do in such a critical area. And to our amazing experts and advocates here who are with us today. This is an issue that I've worked on in our state. It's something that I always cared about, and making sure that people have the time that they need off when they are taking care of a loved one or recovering themselves in such a vulnerable time. It's something that my entire career working in politics I've fought for, but it really is a huge passion of mine after having 2 babies and understanding how essential this time is. And I can tell you how naive I was before I had a baby. I told my employee, my boss in the state Senate, the president, I said, "Don't worry, I'll be back after 2 weeks. You'll have the votes." And I had no idea what I was in for in my recovery with taking care of my newborn, and it just reminded me how so many people who haven't gone through these things themselves that they really are out of touch with the needs that our families are facing. So I'm just grateful for the work of everybody who's here today. And I know we gave a brief intro, but we're going to jump right into a few questions to start the discussion. Also, full disclosure, I came straight here from the airport, taking care of a baby throughout the night, and then showing up here from being dropped off from my car. So, but we'll get through this, like all parents. We figure it out. So first, Jocelyn, just a majority of our workforce has no access to paid leave. And for most people in other countries, paid leave has been a regular part of their life for years. The U.S. is the only in the OECD member country and one of only 6 countries in the world without a national paid parental leave policy. What does paid leave look like in Canada, and is there a federal budget underwater for providing such an important program?
Well, thank you for the question, and thank you for your leadership on this issue and for Rep. Gomez and his leadership of the Dad's Caucus. Let me give you the shortest answer possible, which is a test for me. Paid family and medical leave is, every country has it for a reason. Because it works, because it strengthens people's economy, and we are behind because we don't have it. If you look at Canada, one of many examples, Canada's program with paid parental leave, they give, I think it's approximately 15 weeks for parents, but they also 40 weeks that can be shared across both parents, and there's a cap in terms of how much any one parent can take to incentivize both parents taking some of the leave. As far as I know, Canada's economy is not underwater. If you look at the research generally speaking, we are behind our counterparts in part because we don't have things like paid family and medical leave. If you look at the data, we lose out, I think it's approximately $670 billion in our economy each year that we lose because we don't have women participating in the economy at the same level as other countries. And women's participation is uniquely linked to paid family leave because they do the majority of caregiving. So many of our partners have utilized the strategy of investing in policies like paid leave precisely to increase the participation of women workers. So we are behind and we can do better.
And I think that you just made such an important point is how this is connected to a thriving economy and why this is so essential. It doesn't actually take away from our investments as a country. It pays dividends back. And so it is frustrating to hear people talk about that we don't have the money to do things like this, especially when we're looking at insurance options to pay into it like Colorado has. That is not a burden to federal taxes. Mm-hmm. So for Gary, a lot of your work at Equimundo has been changing the cultural narratives around masculinity and engaging men and boys as allies in the fight for gender equality. Family leave is so important for bonding or caring for a family member, but too often caregiving falls mostly on women in the family. It's no secret that restrictive gender stereotyping still persists in the United States. Are men taking parental leave at the same rate and duration as women?
Thanks for the question and for the invitation. I'm going to look a little bit upstream and maybe affirm the obvious first. Men do care. Our latest data and data from, as we've looked over the years, men are doing a greater amount of the household hands-on care work. The gap between men and women, none of us are averages, so there's lots of women might contest this, and lots of men might contest this. But men are doing almost as much hands-on care as women are. A lot of things come out of that I think we haven't talked about, which is men will vote for care policies. White voting Republican men will tell us they want this stuff, paid leave, subsidized child care, et cetera, as much as...
Wait, can you repeat?
Let me say that again.
Men are doing as much caregiving?
There's a very small difference on average. Yep, I'll hold the data up. The difference is really small, again, on average. All right?
Hey, I have a
Women-
good husband, but I'm
so-
gone part of the time.
Now, you might say that men are doing a little bit of over-reporting, but women agree to most of the to saying their husbands are doing about the same amount of caregiving. It's a small percentage that are off that say it's equitably shared. 90+% of men say it's equitably shared. About 83% of women say it's equitably shared. There's a gap, but it's not nearly as big as it was some years before.
That's great.
Other part is that men care about care. We ask men and women, what gives you the most happiness in life? 90% of both say it's caring for my family. They will also vote for it. Republican voting men say they want all the same stuff as women who vote Democrat do. So we're sort of missing a huge opportunity to speak to men as fathers. And I think part of the paid leave argument also fits in there. The other part is that men are feeling the burden virtually as much as women. We do every 2 years a State of the World's Fathers report that includes the U.S. We compare the U.S. to other countries, lower income and some that are higher income than us. Where do we land? We have put out, in this year's report, we have a sacrifice scorecard. It is a depressing analysis of 12 different sacrifices that men and women give up to do care work. Not surprisingly, the U.S., because we're the best at everything, we are the best at parents being sacrificed to their wits' end. Put that list up. I was going to read it, but I got depressed about halfway through. Taking on overtime, 60-ish%. Less time for themselves, 59%. Reduced spending in some household item they needed, 60+%. Delayed major life purchases, 60+%. Stopped education or future professional training, 70-ish%. Virtually the same for men and women. Tapped into emergency funds, 60+%. Had to refinance their house, a third of men, 1 in 5 women. That list goes on. Again, it's sobering to think, I almost wanted to cross out the caregiving crisis and say this crisis of our economy and what we're living that the other side doesn't seem to be paying attention to is a crisis of care. Where does paid leave fit into that? Men feel, as women have felt historically, economically precarious. The more precarious they feel, the less likely they are to take leave. It's happening in states, and I think we heard before from Dawn for paid leave for all. Men feel more secure taking it when it's statutory, it's provided, than they do taking it when it's voluntary from a workplace. Because even upper middle class women and men are feeling like you could be fired in a moment's notice. So I care about leave. I think leave changes the equation. It does get us toward what we need. But if we don't, as workers and caregivers, feel supported, we're not going to go very far with this. One more sobering piece. Now, you're not going to ask me any more questions because all my data is so pessimistic. But we also came out lowest among these 16 countries in how much we trust in our government to do things for us. Only 21%, women and men, virtually the same number, trust that our government can do things well for us. Low-income men and young fathers were the least likely to trust in government. We know which direction they voted. And so I think someone else earlier said something about we need the policies and we know what those are, and we also know what the politics are. If we want to engage men in this side and Republican voting women, let's put that out there too, we've got to make the presence of a government that can provide services to families, we've got to make it known and felt. Thanks.
Thank you for that. And a quick follow-up. It's so important, and obviously you pointed to how many people care, including men in this country. What are the biggest roadblocks to actually getting this done then?
I think I'd ask your political staff on that question. We want this, right? This is a huge gap between what the constituents want and what we're actually voting for. I would put out there, and we've had fantastic conversations with Congressman Gomez, because I think there is one piece is to say, let us get men to vote like dads. Actually, let's get men to vote more like women, because women have been voting historically for needs of their families. If we can get men to worry less about these so-called tribal differences they're stepping into, and actually to vote for their families, they need these services. I don't see many campaigns, whether those come from the private sector or from political candidates, speaking to men as if they were fathers and care deeply about being fathers. Yeah. Maybe there's a political campaign message out there. that I think would, because we're essentially giving you what you want, because men say they want this.
And in Colorado, we saw this with the data when they passed. We weren't able to get it through the legislature, and it went to a ballot measure. And overwhelming in very red counties, it was still passed with overwhelming support. So it does go across party lines, and I understand why people feel so frustrated with us being unable to do the things that are very popular. So Marianne, Family Values at Work has been on the ground, state by state, advancing paid family and sick leave across the nation. See, this is how I get through the day. My team makes sure I have my questions ready. We know the power and potential of a national paid family and leave program would have for our families. We've been working for decades to push a national program into law, and we came so close to establishing a program through the Build Back Better Act. And unfortunately, the paid leave program didn't make it in final passage. What lessons can we learn from some of the state level campaigns for paid leave programs?
Yeah, well, thank you, first of all, for having me as well, and for spotlighting the work that is happening in the states. Family Values at Work, at its heart, we are a network of state organizations. We are 32 organizations across 25 states. We were really proud to work on Build Back Better and on federal paid leave, as well as at the state level. And we've passed, with our partners, over 82 laws around paid time to care, both paid family medical leave and paid sick and safe days. I want to do a special shout out here to Virginia that just passed this weekend, which is so exciting. And I think I'm coming at this a little bit more optimistically than you are, Gary. Because we do see this working in the states, and we do see it passing even in a harder political climate. I would say some of the most important things that we've learned, some of them feel a little bit obvious now. One of them is that you need to make sure that families can actually afford to take the paid time to care. That seems obvious, but we had to learn that and test it out. One of the other things that we've learned is that it is so important to make sure that everyone who you care for, who you feel is a family member, is covered by these laws. In the earliest days of paid family medical leave, our coworkers, people across this movement realized, oh, my family member isn't in here. I can't care for my siblings. I can't care for my partner if they're not exactly the way it's structured. And we've been able to learn from that and make changes. And today, so many of the laws cover the people that we all consider family. I think the biggest thing we can learn, though, is that this is possible. State paid family medical leave has really shown us what works, what doesn't work. It's given us some testing grounds for things. People are improving on it all the time, and it is absolutely ready to go to the federal level.
That's great. Well, I want to make sure we get to everybody with questions, and we'll see what the time is, how much more time we have left. But next, Vicki. In the United States, there is no federal guarantee for paid family or sick leave. Although the Family and Medical Leave Act of 1993 allows for workers to take unpaid leave for a limited set of family, caregiving, and medical needs, federal law does not require private sector employers to provide paid leave of any kind. And I heard this from businesses in Colorado saying, hey, you already have this, why do we need it? But it covers such a narrow percentage of workers, and it is not paid leave, it's just protecting their job while they're gone. So FMLA was a historic step, and we want to acknowledge that, but we need to do so much more. So what lessons have we learned so far from the states that have had paid leave programs, and did I just repeat myself? Okay. And how have they helped families?
Sure. Thank you for the question. And it's a pleasure to be up here and to know that there's so many folks in the audience who have also done a ton of work on this issue. So I want to give a shout out to folks, and I will do that as I go in answering your question. And thank you so much for your leadership in Colorado as well. It was a pleasure to work with all of you, kind of working to make that happen and then take it to voters. And it was very exciting to see voters approve it and use it. So yeah, I think it's been said up here, there are now, as of when Governor Spanberger signs the Virginia bill in the coming weeks, there will be 14 states plus DC that have passed paid family and medical leave programs. 11 of those are paying benefits right now. California has had this program in place for more than 20 years and has expanded on it, as has New Jersey, as has Rhode Island, as has New York. So we've seen these programs iterate and get better and more responsive to what it is that families need. But we know kind of 7 key things about what these programs do. So first, they boost labor force participation among women and particularly allow lower wage women, Latino women, and Black women to take more leave. In California, we know that caregivers for certain types of family caregiving are more likely to take the leave and come back to the workforce as are new parents when they have access to leave. 2, it improves child health. So children are more likely to get immunizations. They're less likely to have trauma. They're less likely to have behavioral health issues into elementary school when they have access to leave. 3, we talked a little bit about men already, but I think one of the most incredible things about the state paid leave programs, and if Molly Weston Williamson is still in the audience, she just did some great research on this. Men are nearly half of caregivers, and in one case, more than half of leave takers for among new parents in states. And for me, I think one of the most interesting pieces of data is in California when the law first passed, men were like 17% of leave takers in the program's first year, and they've consistently been more than 40% in the most recent years. So we see how culture and policy kind of go together. And particularly as California's policy has been improved with job protection and higher wage replacement rates, how leave has become easier and easier for men to take. 4 is the caregiving piece. So caregivers are more able to take leave to be there for, say, cancer patients or other folks who need care in their families. They're more likely to come back to work, and their care recipients do better. 5 is the business case, and this is one that we hear a lot. In the states that have paid family and medical leave, businesses majority of them are positive about the programs. They've seen people come back to work. They've seen higher productivity. They've seen higher morale. And overall, particularly during the pandemic, the businesses in sort of the northeastern area in Mid-Atlantic we saw their impressions of the programs improve as they saw the value of this program in real time. 5 is around, or 6, whatever I'm on right now, is around reductions in the use of other programs. So we think about paid leave is a program that actually helps reduce government spending in other ways because people are more likely to take care of themselves and their families. They're less likely to fall into poverty, and they're more able to be self-sufficient. And then the last thing is around the economy and growth to the economy. So nationally, we've talked about the value of unpaid care on GDP, but we see money coming back into local communities, and we see people, because they are more able to work, they're more likely to buy goods and services, they're more likely to keep spending. So, these are programs that are win-win-win. There's a growing body of evidence, and I think, to the question that you asked, like, what is in the way, it's really politics, and it's these outdated impressions about individualism and people pulling themselves up by their bootstraps. It's about the role of government actually as a support rather than as a hindrance to people's freedom and the ability to care for themselves and their families and sustain the economy. And, I think it's really about outdated impressions of women and people with lower wages and people of color. And that is what is getting in the way, because for people, for more than 15 years, 20 years, since I've been working on this issue, and I know Jocelyn was working on this before this at the National Partnership, there's data going back close to 20 years showing bipartisan support for this issue. And so this is not a failing of the public to get on board. This is a failing of politicians to understand that this is something that actually will boost their fortunes as well as the well-being, health, and security of their constituents.
But I've been surprised when, part of that is the businesses that lobby so hard against this. This was a bill in Colorado that I think there was more money spent on lobbying against it than at that time anything else previously in the history of Colorado. So when you think about the interests that are invested in trying to protect the status quo, even though there are these economic benefits, people are paying into this themselves, taking it when it's needed. What do you see as, how do we build that bridge with businesses to try to overcome that? And I don't know if any of you want to jump in.
I'll just say I think we need to ask which businesses are the loudest voices, and it's often trade associations that are predisposed to want to protect, sort of an anti-regulatory environment that has very little to do with the facts or the economics about this particular issue, and it's about not wanting interference in an employer-employee relationship.
I mean, I'll just piggyback on that. I think if you look at data from, small businesses and, groups like Small Business Majority, I think you see enormous support for paid family and medical leave and other sorts of investments because they know that without those programs, it's very difficult for them to provide it. The other thing I would say is that even with all of the progress that we've made, in a lot of workplaces, they're still relying on an old model of workers, where workers come and only focus on work and nothing else matters, and it's at least an outdated male-centric model, even understanding that many men no longer function that way. And because of that, they don't want to change, notwithstanding all of the data, even big companies who say this works for us. So I think that insistence on retaining an old model that just requires people to come to work, combined with I think a view that women will just do it, right? Like at the end of the day, our economy has been built on the backs of women throughout our history. And so if they can get away with it and make what they perceive as more profits, they will do it until somebody makes them not do it.
Do you want to add to that? I saw you wanting to jump in.
Yeah, I think there's a lot of men bristling at the system as well and wanting the care time. And I think as we talk to men, they talk about how much it matters do they feel at a workplace that their roles as caregivers are supported. Even when it's offered in quite generous levels at some big corporations, there is an unwritten rule that we don't really expect you or want you to take it. And if you want to get ahead in this kind of I'm against everyone else, and there's often a decision at the household level that his income is going to keep going up because she's taking some time off, she's taking more leave, that he should stay there. So a couple's decision to sacrifice her work and income for a model for him to sacrifice his sense of who he actually wants to be. And I think, there's a lot of very unhappy men in workplaces that I don't think they feel they're allowed to say, we would like this leave too. And I don't, a lot of corporations are giving lip service to it. But as we survey men in workplaces, they say we do not feel that we are supposed to take that voluntary leave. So I think we've got a lot more work to do to get big workplaces on board with some very common sense. They know what ROI means. All of us in the room know as well. Return on investment, International Labor Organization finds every care policy you look at gives at least 2 to 3 times ROI. That means in workplaces, and that means for economies. So this is one of those cases where norms are trumping even economic outcomes for basically short-term shareholder gains. So it is really tough to step up against that because we get called socialists if we dare question that model. But partly, I absolutely agree with you, Jacqueline. We've got to ask those big, deeper questions about how do we set up work. We are crushing workers in this country. And everyone's facing it, but we're kind of said we're told not to complain about it. So I absolutely agree with you, Vicki, as well about the norms. We just think we've got to grin and bear it, and that's the American way, and it's breaking all of our backs.
Yeah, even just being able to have flexible work schedules. It's about getting the work done, not about, I know for all of you parents out there, probably like me, sometimes you're up at 4 a.m. trying to get things done before the day starts, just to because you don't have that catch-up time in the morning or at night. I tell my team, if it's not booked during the day, I have no hands at night. So it's all hands on deck with my kids. So thank you for highlighting that. Is there any other reflections on what we do to try to engage the business community, or are there issues that have come up on ways, when I think about Colorado, and not to just dive into that in the details, but has it been solvent with the money that people are putting in, the money that they're taking out? Is there anything that we can learn from Colorado on to do it better or differently, or is it just kind of a great example of what's going well?
So I don't know that I can speak specifically to Colorado, but I can say that in general, these programs do work. They stay solvent. If there's a problem, there's usually an opportunity within the process to go back and say, hey, let's tweak this thing, let's make it work. But far and wide, this is a program that works for people. And it works for businesses too, as you all were saying. I would say in the conversations I've had with businesses, about half of them are businesses who have genuine questions. And I would encourage you, if you're a business owner, you're listening to this, there are so many of us out here who would love to talk to you about that, in this room, on this stage, everywhere. Let's talk. Let's work through your questions. Then there are the trade associations and some others who maybe aren't interested in those answers. And in that case, I would say it's time for us to be looking at what people want, at what we know has bipartisan support, and what we've seen has worked across the country so far.
Yeah, I mean, just to answer sort of more generally, so all of these programs are set up as payroll contribution systems. Some of them are worker funded only, some of them are employer funded only, some of them, like Colorado and most of the newer programs, are split. The rate of contribution is 1.3% or less in every single place, and that has been true for the 20 plus years that this has been a thing in states. For Virginia, the legislature just went through an actuarial process looking at different models. Again, sort of the same answer comes. This is like a 1% or less kind of thing. And the sustainability and affordability of these programs is really like no other in kind of models of how to create contemporary reflective programs that people and businesses and the economy need.
Yeah, it's when I think about Colorado that we were finally able to get it done. I read an article about 60% of the people who utilized the benefits were women because, now I'm challenging my view because I would say we know that oftentimes it ends up coming down on women for caregiving, but I'm glad that you brought up your statistics because we have to challenge those old views. But just the huge impact that it made for people who were struggling in the most difficult times in their lives. And I want to give a shout out to my friend Faith Winter, who really led the way on that, and huge advocate who got it done and made such a difference in people's lives. I'm going to do one more question, and then if it's okay with all of you, we can open it up to the audience if anybody wants to raise their hand, highlight something that we should be thinking about, or if you all have questions that you want to ask. So the Women's Bureau's Paid Leave Analysis Grant Program, which was successfully administered between 2014 and 16, awarded more than $3 million to 17 states and municipalities to support research and analysis on the implementation of paid family and medical leave programs. Specifically, the grants allowed states to conduct the research and analysis needed to explore, develop, implement, or improve paid family and medical leave programs. We kind of talked about this on what there is to learn from, but the grants directly led to the creation of several states' paid leave programs and helped other states improve existing programs. As we continue the fight for our national paid leave program, what are other ways we can leverage federal funds for technical assistance for states to establish or enhance paid leave programs that provide universal coverage?
Well,
Great question, team.
Yeah, I'm happy to start, and other people can weigh in. I mean, I think that program was really important and consequential. We should have those grants again. To the point that Vicki was making earlier, some of those states were able to do the actuarial studies and were able to do the analysis of what it takes to actually build a program. Some of those early states that adopted paid family and medical leave had existing infrastructure. They may have had disability insurance programs, and so it was easier for them to stand up programs. But for many of the states that are likely to do it into the future, they will need to invest in figuring out what makes sense, what's the right state department to administer it, things like that. So that type of investment was particularly helpful and important. I mean, the only thing I will say about it is that we should be clear that they were dollars to sort of figure out how can we do paid leave in our state, which is different than actually paying for a program. Nobody should be confused about whether or not those grants would have funded an entire program, but they were instrumental in helping states, I think, combat some of the mythology about whether it's doable. And I think it's the type of investment, that's what we ought to be spending money on, and not, tax credits that don't work. That, as Vicki, you alluded to earlier, those grants were instrumental in helping states that may not have thought they could do it to realize, oh, this is possible.
I think a couple ways in which the federal government could help right now. So the federal government has IRS data on businesses, what businesses exist in the U.S. Often states now, the administrators tell us in Colorado and in other places that they don't know what businesses exist, and so they don't have ways to cross-reference to see if they're missing employers who should be paying into the program. There could be funds that are freed up right now. The federal dollars that go to state unemployment insurance programs can't be used for anything related to anything other than unemployment, but there's data that the unemployment system captures and program integrity measures that the UI dollars that the federal government provides can't be used at all for paid leave, and so that could be freed up. Those are like really easy fixes that could happen right now. And then I think there's other ways that federal dollars could be used to help with startup funds and infrastructure startup. There could be economies of scale in creating tech and IT systems that could be used by multiple programs. There's sort of regional models that you could consider. So there's a lot the federal government could do. However,
Do we have bills on all of those specific things?
No.
Okay, are we taking notes here for...
But I want to underscore, I think the most important thing the federal government could do is actually just set up a national paid leave program, like was considered and Build Back Better, because at the end of the day, we know that there are at least 20 states in this country that have never done anything to go above the federal FMLA, which leaves out more than 40% of workers. They haven't expanded their state FMLAs. They have maybe now we have lots of places that have protected state workers with some amount of paid leave, but there's millions and millions of people in this country that don't have access to paid leave and will not have access to paid leave in the way that we've talked about in these 15 states if we don't have a federal proposal or a federal plan that covers all workers in the United States, no matter where they live or what their job is.
Yeah, definitely. Well, thank you for that discussion. We want to open it up for all of you here who are participating. Thank you so much for caring so much about this issue. And if you want to just introduce yourself and then ask your question. I saw you first back there with a tie. Yes.
I guess I'll stand up. Hi, my name's Jordan. I represent Vote Mama Lobby. And I wonder if any of the panelists have any further thoughts on kind of the political challenges around paid leave. Like I've heard many of the panelists generally talk about how there's broad support among the electorate, around the general public, for kind of paid leave policies, and yet this hasn't really translated to electoral success. So I wonder if it's just like if you have thoughts on whether it's just like a money in politics, like trade associations are spending too much money on this. Is it a failure to communicate with the electorate to bring them on board and raise the salience of the issue, or something else that I didn't mention? Thank you.
So I want to start, I guess, and pass it on to all of you. I would say after being in this movement for about 20 years, one of the things that I have seen that's really most critical is lawmakers who really champion these issues. In my own home state of Pennsylvania right now, we have an amazing coalition. We have some really great legislative champions. But for the law to move forward there, we just need a couple of decision makers who are also willing to champion it and move it forward. So one of the reasons why it's great to be in here is to know that we are in the presence of a number of folks who have made this their top priority. I think that certainly the more folks can hear that this is a top priority and the more that legislators can act on it, it will make a change. I think also the more that we can culturally value leave and caregiving will be hugely important. We've all talked about that a little bit up here already, that we are a culture of individuals, and we all have our own individual story. I could probably come up with 5 off the top of my head about ways caregiving has affected me. But we need to listen to those stories from each other, and we need to act on ways that really value those stories. And if we can do that as a culture, I think we will be able to get to paid leave.
And I appreciate your organization's work so much, and representation and life experiences matter, and you know, people, we need to have representation here, people who understand what it's like to go through these challenges today, because it is a much different landscape than it was decades ago.
I was going to commend, if I may, the Dad's Congressional Caucus. I mean, the need for more men putting their identity out as caregivers, telling our stories, not starting with, you know, I'm the provider, here's what I've accomplished in the workspace, but to say, you know, the most important relationship in my life are my care duties. We're inspired by this, by the Dad's Congressional Caucus. We work internationally with the International Parliamentarians Union, which brings together parliamentarians from more than 180 countries on they're creating a caucus within the IPU and encouraging other countries to create where men vote like caregivers. Even though, I should say, all those countries have, surprise, nationally guaranteed paid leave, it's still on average in the rest of the world 16 weeks for moms, 2 weeks for dads. So the gap is still huge in the rest of the world. We are so far behind in the U.S. that we're starting from a low point, and we're equal when we provide it because we started doing it so much later. But there's still a need for advocacy on this globally, and we find that resonates. Men as leaders, corporate, political, and others, leading with the story of, let me tell you who I care about, and I'll tell you the rest after that.
Yeah, I'll add to that and build on something that Gary mentioned earlier. I think we need to help people understand that this is an appropriate place for government and that it has worked, that government programs, that public policies have been a conduit to individual success and to family success in the United States as well as in other countries, that this is a thing that we have done and can do better here. And so we need storytellers to be lifting up the stories of success in states, and we need culturally to be clear that this isn't just an individual problem, it's a shared concern with a shared solution.
Yeah, I'll piggyback right on that point. I think people are not used to government delivering, and they are used to having to sort of pick up the pieces and figure out the care stuff themselves. And so part of the work, because I don't think it's an issue of making these issues salient to people. I think people get this is very relevant to their lives, but they don't always believe that there's a solution that's a government solution that can work for them. And I think that's, you know, it's on us to both make that case, but also to hold members accountable for that. The other thing I would say is the thing that many of us have been much more intentional about over the last couple of years is to make the economic argument. I think people have always been sort of the mind, well, caregiving, somebody will figure out how to get it done. Let's focus on these serious, quote unquote, economic issues. But what the international story tells us is that many countries have invested in things like paid leave as an economic strategy because it retains women workers. So reinforcing that economic narrative over and over again, I think will help us in the long run.
We have a time for one more question. I did the right side. Anyone on the left side want to ask a question? We can go back to the right side, or my right side.
Hi, everyone. Thank you so much for the panel today. My name is Gina Kelly. I work for the National Association of State Workforce Agencies, where I work with the 13, soon to be 14 states in DC who administer and run these programs and deliver benefits to people. The panelists sort of touched on this, but I was wondering if you could speak a little bit more about how these 15 programs are going to be able to interact with a federal mandate. I think, you know, most of our directors want as many people as possible to have paid leave, and they believe in it so much, but I think they worry about ensuring the integrity of their programs and ensuring that the reasons why each state has a different program is still able to meet their constituents where they were. So I wonder if we could speak a little bit more about that interaction.
Great question.
I mean, this is my personal view, but I will say I completely understand it. And I think when people go through the trouble of standing up a program, they ought to be able to keep their program. And so my argument, and Vicki said this earlier, about a national program, is that any employer who worries about 50 separate programs ought to be standing up first in line to say we need a national program. Because once people go through that struggle and problem, and I think in Build Back Better, if I recall correctly, there were provisions in it to try to accommodate the fact that states that had existing programs wanted to be able to retain it. I support it. They did the hard work to stand it up, and I respect that people should be able to do that. I suspect there are ways to ensure that there are minimal differences between states, right? Like there's some efforts to try to do that. But I think that's why a national program makes so much sense, because I completely hear you and I agree with you.
That's it. Yeah, I'm just excited to hear from all of you on this because of how it impacts a state like mine.
Yeah, I think what Build Back Better did, what the program that would have been in Build Back Better did, was to create sort of a minimum level, and it allowed states that already had programs to kind of certify, make changes, and then certify that it met that level. The federal program would sort of oversee that. And that would mean that those states could keep their programs, they could continue a race to the top where they were doing better than the federal program, and that some of the costs would be offset. And I think that is like a fair way to accomplish a baseline for the whole country while still recognizing that we don't want to limit states' progress if states want to do better.
That's great. Well, join me in thanking our panelists for the work that they do every day. It's so inspiring to be here with you. It's difficult in this time when so many things are being rolled back to. So thank you for inspiring all of us to remember what we're fighting for the future. We appreciate you. And thank you all for joining.
That was perfect. You're perfect. All right. She's going to... We can get you the first seat. Yeah, first. Oh, come on. We'll have you. Just one moment. We'll have
How are you?
I'm good. We'll have you just go through this here.
Thank you.
Yeah, please. Yes, great job. We'll have you. So we can have you do this here.
Thank you.
No, of course. No, thank you. You're always the best one.
Oh, you're so
No, for real. You're good.
Because I make fun of myself?
No, because you're very valuable at the conversation, going and flowing between the questions and asking for things. Hey, it's really good. Yeah, I'm serious.
So good to be with you all. Hi. What an awesome lineup here.
We're a little closer. Perfect. Let's see what's going on, Steve. You ready to do it? Okay. Hey, Josh, how's it going? Josh Hodges. Hi, Josh. Please come on up. All right. Okay. Yeah, of course. No, I mean, I thought I was serious. No, I was serious. She goes, she goes, great questions. I don't know if that was. Let's see. Where's for the Reverend Senior? Congressman Horsford is arriving momentarily, so we're going to start with that. You've got, everyone's got water. You're all set. And your microphone. Yeah, we're just waiting on horse food and then we'll get started.
Carlos. Carlos and Maria. Thank you for all your help.
Happy to do it.
Yeah, my pleasure.
Excited. I mean, we just, because your horse, we're just walking up.
Is this the only middle for a bit of the majority?
Yes.
Yeah. The gender ratio is reversed.
Yeah. you have this printed out? Do you have this memo printed out? If JG needs to do it, will you go out there and just ask him? Yes, sir. Will you double check? That's what I'm. Yeah, go in. All right. I wasn't one to print it. Yeah, you're fine. Like every good summit held in Washington, D.C., there was a motorcade. Congressman Gomez will be moderating our panel today. Our final panel today is Independence and Dignity, Investing in Home and Community-Based Care. This conversation focuses on the services that allow older adults and people with disabilities to live independently in their homes and communities. Joining the Congressman is Josh Hodges from the National Council on Aging, Stephen Lieberman with the United Spinal Association, Jason Resendez with the National Alliance for Caregiving, and Maria Town with the American Association of People with Disabilities. One quick note, votes are expected on the House floor at 3 p.m., so we'll move straight into closing remarks after this panel and forego Q&A. Thank you.
Thank you, Carlos. First, I'm not supposed to be stepping in on so many panels, but one of the other panels, we had Congressman Raul Ruiz had some flight issues, we had some weather, and then we had Stephen Horsford. So if he comes in, if he makes it, we'll let him just jump on in. Excuse me. And the reason why Representative Horsford was going to fill this role is that not only is he a Dad's Caucus member, but his mom just moved into his home as the fact that she's just aging, she needs more help. So she moved into his home in Las Vegas. And now he's living through it, like a lot of American families are living through it. How do you kind of balance things out? How do you manage their care amongst just different agencies? How do you make sure that they get their benefit? So he's learning, and he's a proud mama's boy, and he can really kind of help lead this discussion. With that, I'm going to hand it over. Thank goodness. To Representative Stephen Horsford to help lead this panel. Stephen.
Congressman Gomez, for your tremendous leadership. I apologize, but the president's motorcade was leaving the Capitol as I was coming over. So thank you for your work as the founder and the leader of the Dad's Caucus, and for convening this national summit on the caregiving crisis. Men, we have a perspective on the national crisis that's affecting our care economy, both as caretakers of our children and many of us as our parents. I am living this example as someone who's in the sandwich generation with 3 college-age children and a mother who just experienced a severe stroke. And as part of her caregiving, it has been part of my responsibility, along with my sisters, to step in and to fill that gap, to navigate the broken healthcare system, a system that has created too many barriers for people to access the care that they need, and the care workers who are on the other end of having to provide that care, whether that is in-home care, whether that is care in a nursing home or in a skilled nursing facility. It's an impact that every one of us will have to go through at some point. So the caregiving economy is an essential aspect of affordability for working families. It is an expansive field and one that nearly every person will encounter during their lifetime. These are our child care workers, our elderly care workers, and most importantly, our neighbors. Our neighbor with a disability who lives on their own, or a neighbor with a newborn who is on parental leave, if they have access to that leave, or a neighbor who is taking care of their elderly relative. The reality today is that working people are being faced with an impossible decision between necessary care for themselves and their family, or paying those bills out of their pocket. Healthcare has been used as a political pawn, and the cuts that now have been realized by this one big betrayal of a bill, the fact that they found billions to give tax breaks to billionaires and to big corporations, permanent tax breaks, and in the same bill cut $1 trillion out of our healthcare system, $300 billion out of nutrition. It's the same bill, by the way, that funds $75 billion to ICE, a rogue agency that has to be reined in. And now they're spending billions of dollars a day for bombs in the Middle East, but can't find a dime to provide services for working families in health care, or in elder care, or in child care. Working people deserve solutions to these impossible decisions that they're being forced to make every single day, and they deserve a system that works for them and that protects their care. That's why we're here today. That's why the work that Congressman Gomez and the Dad's Caucus is doing is so vitally important, because it's not just about the problem. We need solutions. And our panel today focused specifically on home and community-based care. As the cost of living rises, more and more families are having to learn to become caregivers themselves and facing these unique challenges. What I've learned is that someone who's going through these difficult decisions, they still deserve dignity. They still deserve our respect. Whether it's the elderly parent who deserves to be taken care of in the most supportive environment, that's dignity. Or the home care worker or the skilled nursing worker who deserves respect on the job with a livable wage and benefits so that they're not living in poverty while they take care of our loved ones. So I'm looking forward to this important discussion and to hearing from our panel of experts on how to address these issues and to create solutions that work for working people. So let's get right into it and ask each of our panelists to kick us off here with just a brief overview of some of the access to care and waiting list issues that we are experiencing for millions of older adults and people with disabilities. The ability to receive care at home rather than in institutional settings is not just a preference. It's a matter of dignity, independence, and quality of life. Programs that provide in-home assistance, personal care, and community supports allow people to remain connected to their families and communities. But despite the clear benefits, many families across the country face significant barriers when trying to access these services. In some states, individuals remain on waiting lists for months or even years before receiving the support that they qualify for. During that time, families often have to step in themselves, leaving jobs or cutting back on work hours to provide care. I'm waiting literally right now for 21 days to do an assessment for in-home care on my mother. So from your perspective, what are the biggest barriers preventing eligible individuals from accessing home and community-based services, and what steps could Congress take now to reduce waiting lists and expand access?
I'll kick us off.
Thank you.
Hello, everyone. My name is Maria Town. I serve as the president and CEO of the American Association of People with Disabilities, or AAPD. AAPD is a national cross-disability civil rights organization. We are disability-led, and we are working to increase the political and economic power of the more than 71 million people with disabilities across the United States. In addition to my professional role, I am also someone who has relied on care and has had that care taken away because of brutal policy decisions by a state government. I'm someone who still relies on care today and is having to do things like show up to this event with one of my shoes off and asking a friend, can you help me put my shoe on? And I've been a caregiver myself. And I think it is really important to acknowledge that people with disabilities, children, and older adults, the communities that we highlight as needing care, are also often caregivers. Caregiving itself is disabling work, speaking to the point about dignity, Congressman. So let's talk about waiting lists. Right now, there are about 600,000 to 700,000 people on waiting lists across 41 states. I have friends who have been on waiting lists for 16 years, 17 years. My friend Lorna, her son, has been on a wait list for home and community-based services for the majority of his life, and he's 20 years old. Now, these wait lists indicate an enormous need for home and community-based services, but they don't indicate the full need. The wait lists only show us who has even gotten to the precipice of the system. They don't show us who's still struggling to even figure out a way in. They don't show us who the state has already said no to or deemed ineligible. The need for these services and supports is so much greater than the data we have, and Jason, I know you're probably going to give us all of the data with your great work. So we can use wait lists as a kind of benchmark, but we cannot use wait lists to measure comprehensive need, because the need is much, much greater. How do we reduce these wait lists? The HCBS Relief Act, which would increase federal FMAP by 10%, increasing provider wages, expanding HCBS access, and providing things like paid leave for direct support workers. Establishing a national Medicaid buy-in program. Right now, in states like Massachusetts or California, people with disabilities can still work and buy into Medicaid so that at the moment you need long-term services and supports, you do not have to impoverish yourself in order to get the services you need to survive. Why isn't this available in every state? If we're talking about a national paid leave program, we should also be talking about a national Medicaid buy-in program. Finally, I just want to say, when you have a child with a disability or when you become disabled, disability doesn't wait. And that's why care can't wait. Disability doesn't wait for you to get your documents in order. Disability doesn't wait for you to get assessments. You need care from the moment you become disabled. And we have to ensure that our systems that support our older adults, our disabled people, our children, actually mirror our real lived experiences. So with that, I'll pass it on to you, Jason.
Josh, I'm going to also bring you into this to ask, building on the question around how we address cost savings and health outcomes. Many advocates, providers, and families advocate for in-home and community-based services, yet they're not only what people want, they can also lead to better outcomes. And when people receive support at home, they may be less likely to experience preventable hospitalizations or emergency room visits, which are more costly and don't produce the same outcomes in their care. They may also avoid the higher cost associated with long-term institutional care. So can you discuss the evidence around home and community-based services and how they affect health outcomes and overall healthcare costs, and what that means for federal policy moving forward?
Absolutely. First off, good afternoon, everybody, and thank you to the Congressional Dads Caucus for hosting an event like this, because the number of times I talk to people on the Hill and around communities around the country who don't understand how care works in this country is significant. So it is really good to be in a room with individuals who have had this experience themselves so that we can actually have these conversations and have some meaningful talk. The National Council on Aging, we are focused on helping all people age well. We believe that we have to create the conditions so that aging well exists for everybody. This doesn't only impact me professionally, I'm also a father of 4 and a long-distance caregiver to my mother in Texas. So I understand that being a mama's boy, I'm a proud mama's boy myself, sir. And so it is about that long-distance caregiving. But HCBS, Home and Community Services, aren't just a nice to have. They're an economic engine. They drive the economy. It allows for caregivers to go back to work. It allows for individuals to stay in their homes and their communities where they want to live. That is a dignity that they deserve. That is a dignity that they have earned. Aging well is not just something that we should strive for. It is something that should be allowed for everybody to happen. But the reality is there are a lot of barriers that prevent many people from aging well. But let's talk about HCBS. Let's talk about what it actually means. Often people think it is the same thing as institutional care. The reality is it drives cost savings. It drives a significant decrease in cost. It drives a significant increase in real-time healthcare. There are pilots out there demonstrating that we have professional healthcare providers coming into homes, decreasing ER visits, decreasing cost. This is something that pays for itself. This is something that when it's done at scale, we can see real results and we can see real impact, because it allows people to not only have the lives that they want to have, and it allows them to save money. And we often talk across the street about the economy and how this is an additional cost. But the reality is this is a cost savings program if we do this right and at scale. And it is a health care program. So we are honored at the National Council on Aging to be for home and community services and for the direct care workforce. Talk about policy solutions. In addition to increasing the investment in home and community services, we have to talk about shoring up the direct care workforce. We have underpaid, undertrained, and underappreciated direct care workers across this country. That has to stop. That has to end. The last thing I'll say is I've been in the aging space for nearly 20 years now. The number one thing I still deal with when I go out and talk to the public is I'm not worried because Medicare is going to cover it. Medicare is going to cover it because of course it is. This is the program that we've all been earning towards. This is the program that we've been told consistently is going to be there for us. And let me tell you, it's not. The fact of the matter is we have to rely on Medicare to step up in the future. So we want to see that.
We got to save it, strengthen it, and make it deliver on all the promises that it's made. And there are key provisions. I know as members of the Ways and Means Committee, we are debating these issues and pushing for them. Jason, I wanted to ask you about the fact that around the workforce challenges, there are 53 million unpaid caregivers, people providing care for their loved ones in the home in America. 53 million unpaid caregivers. At the same time, caregivers frequently face barriers when navigating complex healthcare systems, including prior authorization requirements, fragmented care coordination, and a limited access to caregiver-focused services. Strengthening support for caregivers is not only a matter of compassion, but also essential to maintaining a sustainable healthcare system. So what steps should Congress and federal agencies be taking to better integrate caregiver assessments, care coordination tools, and support services within Medicare and other federal health care programs so that family caregivers are not recognized and supported, so that family caregivers are recognized and supported as essential members of the care team. My mom currently has 5 caseworkers throughout all of her health care. 1 for the insurance company, 1 for Medicare, 1 for Medicaid. It's ridiculous. I tried to get all of them on one call one day. That didn't go too well. But the problem is, if it's this hard for a member of Congress, imagine how hard it is for people who are already stretched thin. So, what are some steps that Congress should be taking around the care coordination and breaking down these barriers?
Absolutely. Well, first, thank you, Congressman Horsford, for continuing to lead with your lived experience. Same thing to you, Representative Gomez. And thank you for shining a spotlight on how care connects so many of us. As you said, 53 million. And today we know there are actually 63 million, 10 million more people providing ongoing, demanding care in this country than just 5 years ago. Nearly 50% increase from 10 years ago. So this is a growing challenge that we continue to strive to make progress on. And there is a tremendous role for Medicare to play in recognizing and valuing the contributions of family caregivers, because they are one of the most underaddressed, underrecognized, and undersupported extensions of the healthcare workforce. Of those 63 million Americans providing ongoing, demanding care, over half are assisting with complex medical and nursing tasks. Things like changing feeding tubes and PICC lines and learning how to do all of that on YouTube because they're not receiving the training and support. In fact, just 22% of family caregivers managing those medical and nursing tasks report that they've ever had a conversation with a provider about how to actually navigate that complex care. And when they don't get that training, they are facing burnout. They're not feeling confident in the kind of care that they're providing. And what happens is that we see increased cost, right? Increased hospitalizations, increased ER visits. So there's an economic cost that comes when we don't support family caregivers in navigating and providing that type of care. So there's a lot of that Congress can do. One is we're seeing some limited progress in the Medicare program. As of 2024, there are new reimbursement codes that for the first time incentivize providers to identify and provide training to family caregivers navigating those complex costs. But there's so much that could be done to scale the implementation and access to those new reimbursement pathways. And then second, I think something that Maria addressed beautifully through her remarks is that we live in a country where home and community-based services are optional benefits. So they're the first on the chopping block when it comes to tight state budgets, and that's certainly something that we're going to face over the coming years. So I think there's an opportunity to make home and community-based services a mandatory benefit to complement the essential work and support through the Medicare program. So I think while it's an uphill battle, there's tremendous opportunities for congressional action and recognizing and valuing the contributions of family caregivers.
So let's focus on the impact of the $1 trillion cuts to healthcare, the healthcare system, largely from Medicaid, that's now law from this big ugly betrayal of a bill. Medicaid is the largest payer for long-term services and supports in this country, including home and community-based services that allow people to receive care in their homes rather than institutions. However, many states struggle with funding constraints, which can lead to limited provider reimbursement rates and difficulty sustaining a stable caregiving workforce. Families often encounter waiting lists that you've noted for services or challenges finding available caregivers when and if they get approved in their communities. So in your view, any of the panelists, how could federal policy, especially within Medicaid, better support home and community-based services while also strengthening the caregiving workforce that makes those services possible?
So I'm Steve Lieberman. I'm the Senior Director of Advocacy and Policy with United Spinal Association, and we're the largest national nonprofit representing wheelchair users around the country. The one thing, and just to thank you, Congressman Horsford, for the care and attention that you're providing to these issues and your experiences with your mother and seeing how that really shines a light on what so many people around this country are dealing with every day. The Medicaid statute was written 60 years ago. I think in many ways it is outdated, and it's a product of a time where we had different attitudes as a society about aging, about disability, about healthcare in general. The institutional bias that is written into the Medicaid statute is something that is a product of its time. I think by ending the institutional bias and by making home and community-based services mandatory throughout the country, we would no longer see the challenges that we're facing right now in states all across the country, driven by the steep Medicaid cuts that were passed into law last year, that now states are being forced, because it is optional under the statute, to make these horrific cuts that we frankly all warned would happen with the passage of H.R. 1. We need to end the institutional bias. We need to invest in the home and community-based service space in terms of investing in home care workers, improving their pay, their benefits. The caregiving economy is incredibly important for the overall economy. Think about how many people are forced to make an impossible choice. If somebody that they love requires care, should someone develop a sudden onset of a disease or disability, they then have to make the choice: do I leave the workforce, quit my job in order to provide care for my loved one, or do I put them into a nursing home because I have no other option in order to maintain the care for my loved one and maintain income for my family? So we have choices to make.
That's a false choice for people to have to make, right? Like, you should be able to continue to live your life while supporting the people around you to live theirs in quality. And the fact that millions of Americans every day are making this choice. Meanwhile, here in Washington, you have policies that favor the ultra wealthy on the backs of the very people that we're talking about, both the workforce, the people who are in this care economy, as well as those who need to receive that care.
Right. This is a policy choice.
So, Jason, and then we're going to turn to questions, and I know votes have been called. I wanted to ask you about the Older Americans Act and the programs within it, such as respite care and caregiver support services, which are designed to provide relief, guidance, and resources that allow caregivers to continue providing care while maintaining their own well-being. However, many caregivers still struggle to access these services. Research shows that 39% of caregivers say respite care could be helpful, yet only 13% actually use it, often due to limited availability, awareness gaps, or structural barriers within local systems. From your perspective, how can Congress improve federal investment and coordination in programs like the National Family Caregiver Support Program and other community-based services to expand access to respite care and ensure that these supports reach the caregivers who need them the most?
Great. Well, one, and I think this is a common refrain on a lot of issues, is we need to increase funding for the Older Americans Act National Family Caregiver Support Program. In an era of cuts and program eliminations, we saw a tiny bump for the National Family Caregiver Support Program at their level around $205 million. $205 million is a trickle in the bucket of the federal budget, but it represents a lifeline for a family caregiver in Utah, California, Nevada, who just got a diagnosis, or a caregiver who needs to take 2 hours of respite from her mom's Alzheimer's care in order to go to a doctor to access preventative care services. So we can do so much more to expand the capacity of the National Family Caregiver Support Program with modest increases in federal funding. Second is reauthorize the Older Americans Act. The Older Americans Act has not been reauthorized, so it's in a precarious position. We're excited to see continued
It hasn't
funding.
been reauthorized since when?
It hasn't been reauthorized since 2022. So we are seeing progress. There was a bipartisan deal at the end of 2024 that got blown up by political headwinds, and that was
Elon
a
Musk.
shame. That's
called
from
it
your mouth to God's ears.
Balls and strikes, as Representative Gomez says.
Absolutely. So I think those are two, bipartisan, very much supported across the board ways to get more capacity into the aging network to serve family caregivers today.
So we're going to turn it over to all of you if you have any questions for our panel. Are we asking? Okay. I've been directed otherwise. So we are going to thank our panel for your participation today. Let's give a round of applause to them. To my colleague, friend, and the leader of the Dads Caucus, Jimmy Gomez, Hodges' dad. That's what we should call the Dads Caucus. Thank you for your leadership.
Let's give a round of applause to Stephen Horsford, the great congressman from Las Vegas, Nevada, and make sure that we all want a son like Stephen Horsford, a mama's boy who is going above and beyond to take care of his mother. So let's give him a round of applause. And I'm just going to close out, take these moments to close out. First, thank you just so much for joining the first Congressional National Summit on the Caregiving Crisis. Today we heard from members of Congress, advocates, labor leaders, and policy experts about the urgent need for Congress to address this crisis head on. Donald Trump said he was going to tackle the cost of living, reduce it on day one, and he failed to do so. And one of the things that we're trying to do with this summit is to bring together the people that really have been in this fight way longer than a lot of these members have been. A lot of members who have actually been in Congress for a number of years. Because we want to say, for once and for all, this is a crisis that we are going to tackle. Coming from the labor movement, I believe in the inside-outside game. That you have people fighting the good fight on the inside, but then you also have the people on the outside making sure that the public sentiment is there to pass these policies. This is something that we need to address. We're talking about this issue from a variety of perspectives. And for the first time, we have broad support within the Democratic caucus. I'm talking folks that are ideologically diverse. We had Brad Schneider, who's the chair of the New Dems, who's also a Dad's Caucus member that was advocating for affordable child care as well as elder care. We had Greg Kassar, who is the chair of the Progressive Caucus. We have people from across the country. And that tells you that the moment is right. This is the time. This is our moment. We should not let it pass. But we need to continue to build and then lead the entire caucus into a direction that the only decision is paid family leave, affordable child care, the enhanced child tax credit, as well as senior care that allows people to age with dignity, either in the home or in a hospital if needed. And that's what we're trying to do. You've done the work. You've laid the groundwork. Now we're just going to make sure that we get it across the finish line. And when we do that, when you take care of the affordability crisis by centering the family and the care of that family, you restore people's faith that this country has the right set of values, and you restore people's faith that government can actually help them get by. So if we want to tackle all these problems, we must tackle it with the family and the care people deserve front and center. So with that, I want to say thank you. I know some of you guys should have the information to a reception we're going to have later. This is not the end. We're planning on doing this several times, and we're going to make sure that you guys are there when we pass some of these pieces of legislation into law, once and for all, and that's the thing. And one of the things that I hope come out of this, even when I'm no longer in office, I don't plan on serving until I'm 80, just because I have a son to raise as well, that elected officials come and go, but the community remains. And how we train all of you, how you guys pay it forward by training your own members, your own colleagues, other caregivers, we know that our best days are just ahead of us. So thank you so much for coming by. Thank you.